All right, so let's take a look at some blood vessels and nerves. We might as well do them all together. These blood vessels here are the femoral artery and vein. The femoral artery is a continuation of the external iliac artery, and the femoral vein is the continuation of the external iliac vein, as you might guess. Now, when you cross the inguinal or inguinal ligament, that's when you essentially become the femoral artery and the femoral vein. The nerve right next to it is the saphenous nerve, and the saphenous nerve is going to be involved in innervating predominantly the skin around the knee and also the dorsal surface of the foot. Okay, let's take this on down. Here's our old friend here, if we can find him. Let's remove some of these parts. See it? This is the sciatic nerve. And let's take a look. Let's remove these hamstring muscles. You can appreciate how the sciatic nerve goes all the way down and then eventually branches just above the knee into the common peroneal nerve. It also forms the tibial nerve, so going way down here. Now, if you follow this artery that goes next to the tibial nerve, you can appreciate how in the back of the knee, this is the popliteal artery. It is a continuation of the femoral artery. These are the geniculate arteries, essentially framing the joint of the knee in the back. And then we have, once again, this is the posterior tibial artery coming all the way down, following the tibial nerve. The nerve branch that comes off this way is the fibular nerve or the peroneal nerve, and specifically the common fibular or peroneal nerve. And that one is going to go travel to the front, where it will split into this one, which is the deep fibular nerve, and this is the superficial fibular nerve. When damage happens to the deep fibular nerve, you have permanent foot drop. In other words, you cannot dorsiflex. By contrast, when you have damage to the tibial nerve here, you have permanent dorsiflexion, indicating the muscles that are affected, of course, by each of the nerves.